Hello, I'm Dr. Helen Pensanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that affects more than 100 million people worldwide. It's called psoriasis vulgaris. This is the most common type of psoriasis, and while it's not contagious, it is visible, persistent, and often misunderstood. To help us break down the facts, the treatments, and the hope with new options for it, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board certified physician and pioneer in regenerative medicine. Dr. Henderson, thank you for being here.
Well, thank you for having me.
What is psoriasis vulgaris?
Wow. Psoriasis vulgaris is a chronic skin condition where the skin cells build up faster than normal and form a thick, scaly patch that can often be itchy or painful. It's an immune-mediated condition, meaning that the immune system is mistakenly overactive and speeds up the skin cell cycle. Also, there are various types. Plaque psoriasis is the most common, but there's also guttate, pustular, inverse, and erythrodermic psoriasis. Each have different patterns and different severity.
So I am guessing that genetics plays a role in this.
Yes, ma'am. We know that psoriasis tends to run in families, and certain traits can make someone more susceptible, especially when combined with environmental triggers like infections, skin injuries, stress, or certain medications. These genetic differences influence how the immune system in our body reacts, which can lead to inflammation and rapid skin cell turnover seen in our psoriasis.
Let's talk about the early development and how it affects the skin.
The skin structure and immune defenses are set up during early development in the womb. The way those symptoms form can influence how the skin responds to inflammation later in life. That's one reason why some people's skin reacts more strongly to certain triggers.
So, what symptoms should people be looking out for?
I think the hallmark is raised red patches. Sometimes they're covered with that silvery white scales, most often seen on your elbows, knees, and scalp, and sometimes even the lower back. Some people experience itching, burning, or soreness. In more severe cases, psoriasis affects the nails, causing pitting or thickening, and involve large areas of skin, which can impact the quality of life.
Well, how do you diagnose psoriasis in your office?
Diagnosis is mainly clinical, meaning a doctor examines the skin, takes a medical history. In some cases, we do a skin biopsy to rule out other conditions. We also look for associated problems like psoriatic arthritis, which can cause joint pain and stiffness.
All right, let's talk about standard of care treatment. What works best?
Treatment depends on the severity. For mild cases, there are topical creams and ointments, and they can have corticosteroids. There's also vitamin D analogs or tar preparations.
What are vitamin D analogs?
Vitamin D analogs are synthetic or modified forms of vitamin D that have varying biological effects, particularly in the context of chronic kidney disease or psoriasis. They work by interacting with the vitamin D receptor in the skin.
Very interesting. What are the tar preparations? Of course, we all as physicians know about it, but our listeners are, you're going to put tar on me?
Coal tar preparations are often used in conjunction with other psoriatic treatments and can help manage psoriasis symptoms by reducing scaling, itching, and inflammation. They are available in various forms, including shampoos, gels, and ointments, and can be used alone or in concert with other therapies like corticosteroids and phototherapy. They're generally very well tolerated, but you need to be under somebody's care to make sure the side effects are not experienced skin irritation, photosensitivity, and staining.
Okay, let's go to our traditional Chinese medicine. What do the Chinese for the last 5,000 years done about it?
Yeah, no kidding. Traditional Chinese medicine can offer supportive care, and psoriasis is seen as a result of a blood, heat, or wind dryness in traditional Chinese medicine theory. Herbal formulas nourish the blood, moisten the dryness, and acupuncture points may help reduce the inflammation and surely improve circulation. These approaches work best when combined with conventional care and guided by experienced practitioners.
All right, we are now on the forefront of regenerative medicine, and it's going to be a standard of care in every office in the land pretty soon. People like you that are on the forefront of it are already doing it, but what are the options?
Well, there's no question regenerative cells include multiple options. It's often begun with exosomes. They're being explored for their ability to reduce inflammation, help rebalance the immune system, and make new cells. Some peptides are under investigation for modulating immune function and supporting skin repair. While these are still emerging therapies, they're showing a lot of promise in early studies.
What can patients do day to day to help manage symptoms?
Oh, good question. They moisturize their skin regularly to prevent the dryness and avoid the known triggers. Protect your skin from injury and manage stress, which can trigger flares. A balanced diet is always a good idea. Omega-3s, antioxidants, and vitamin D may also help. And keeping up with the medical follow-up ensures treatment stays on track.
So, what's the outlook for these patients?
Well, psoriasis is lifelong, but many people achieve long periods, I'm talking years, with the right combination of treatments and lifestyle adjustments. The key is still early intervention and consistent care.
Well, let's do your mnemonic for psoriasis.
Okay. Skin.
S stands for?
Soothe inflammation. Medications and phototherapy.
K.
Keep skin moisturized.
I.
Identify and avoid the triggers.
N.
Nourish with a healthy diet and lifestyle.
Thank you, Dr. Henderson, for helping us understand psoriasis vulgaris. It may be a chronic condition, but with today's treatment, as Dr. Henderson pointed out, there are options and healthy self-care habits that can help patients live a full and active life. If you or someone you know is struggling with psoriasis, remember, you're not alone, help is available, and with the right approach, clearer skin and a better quality of life are possible. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.